three significant events took place in Tennessee during the year of 1911. East Tennessee State Normal School opened its doors to education in Johnson City, and Memorial Hospital was established. Also during 1911, the Nurse Registration Act was passed in the state of Tennessee, regulating the practice of nurses and granting formally trained graduate nurses the right to practice as registered nurses. These events formed the roots of ETSU's College of Nursing. While as early as 1903, Johnson City had a hospital on the Mountain Home Military Reservation, now the VA campus, where it served military veterans. However, the community lacked a hospital for all of its residents. In addition, there was no formal training for nurses available in Northeast Tennessee. 6 local physicians recognized the need and in 1911 established Memorial Hospital, the first in a progression of 3 hospitals that included schools of nursing and became the forerunners of ETSU's College of Nursing. Memorial Hospital began with 10 beds in a small wooden duplex and offered a training school for nurses. Amelia Young, a 1911 graduate of Lincoln Memorial Hospital's Training School for Nurses in Knoxville, was hired as the first superintendent and director of the Training School for Nurses of the newly established Memorial Hospital. Her duties included taking full charge over the hospital and management of its affairs, the nurses and their training, and assisting with the care of the patients. The Nurses Training School opened with 2 student nurse probationers, Miss Orlena Elizabeth Morris and Miss Lucille Andis. The nursing students worked at the hospital during the day and attended physician lectures at night. In 1912, Orlena Morris became the first graduate of Memorial Hospital Training School for Nurses, followed by Lou Andis in 1913. During this time period, it was clear that nursing in the Appalachian region was not considered a respectful profession. Mrs. Ann Reel, the grandniece of 1912 graduate Orlena Morris, remembered her great-aunt Lena and shares memories of conversations with her aunt.
Aunt Lena once told me that she had been the first nursing graduate at Memorial Hospital School of Nursing. Her family was scandalized over the possibility that her professional duties might require her to see and or touch male patients in a state of partial or full undress. My spunky old aunt dismissed those fears with one snort. Lena had a backbone of steel, and her being a nurse was one of the most important things in her life.
Few formal records from Memorial Hospital exist from 1911 to 1921. Known is that Amelia Young remained at Memorial Hospital as superintendent for only 6 months. In her memoirs, Miss Young states,
I found this a lot of responsibility for a girl not yet 21 years of age. So in October of that year, I decided to accept an offer by the Metropolitan Life Insurance Company in Knoxville to start their visiting nurse program offered to their industrial policyholders.
Superintendents of the hospital and training school for nurses that followed Amelia Young were Lulu Hodge in 1911, Lena Singleton 1914, Amanda Jarvis 1917, and Marie Smith 1919. The first Memorial Hospital continued to serve the community until 1921, but the need for expansion of hospital space was identified as early as 1915. By 1921, funds had been acquired to build a larger facility. Memorial Hospital was renamed Appalachian Hospital. Appalachian Hospital served the community from 1921 to 1951, and its School of Nursing grew. Miss Ida Garrett, a graduate Knoxville General Hospital, became the first superintendent of nurses in 1921. By that time, the nursing program had expanded from 1 to 3 years, with students earning a diploma in nursing upon completion of the program, and were eligible to take the state exam for the right to practice as a registered nurse. Students spent 60 hours per week in the program, 56 hours in hospital work, and 4 hours per week in classroom lectures that were conducted at night. There were a number of superintendents that followed Ms. Garrett, including Vesta Schwartz, who came from Maryland in 1941. Ms. Schwartz was a visionary, a forward thinker and architect of the ensuing partnership with ETSC. By 1943, Appalachian Hospital and ETSC reached an agreement where Appalachian Hospital nursing students could take courses for credit at ETSC. Courses included psychology, sociology, English, and chemistry. In 1949, ETSC and Appalachian Hospital established a formal affiliation where Appalachian Hospital nursing students received their first 9 months of coursework at ETSC. These courses included physiology, psychology, sociology, principles of nursing, English, microbiology, chemistry, nutrition, and cooking. Students continued to receive their clinical training at the hospital. The partnership continued, and in 1950, a nursing council was formed between members of ETSC and Appalachian Hospital. ETSC members were Dr. C.C. Sharon, Dr. P.W. Alexander. Appalachian Hospital members included Dr. Carol Long, Dr. J.R. Bowman, Ms. Vesta Schwartz, RN, Ms. Eileen Johnson, RN, and Ms. Ruby Norris, RN. Also included in the council were Dr. C.C. Mullen and Mrs. Helen Jean from the Washington County Health Department. Again, due to the growing needs of the community, a larger hospital was needed, and by 1951, Appalachian Hospital merged into a new, larger facility and renamed Memorial Hospital. The 3-year diploma program continued as Memorial Hospital School of Nursing. ETSC provided faculty members for the classroom instruction, and the hospital provided the teaching staff for their clinical instruction. In 1952, the Nursing Council sought and received a 5-year accreditation from the National Nursing Accrediting Service for Memorial Hospital's nursing program. Also that year, the Tennessee Council for Nursing Committee for the Expansion and Improvement of Nursing Education recommended that ETSC establish a 4-year baccalaureate program in nursing. The Nursing Council spent 2 years planning and developing the program. In May of 1954, the Nursing Council, comprised of members from both ETSC and Memorial Hospital, had developed a program leading to a baccalaureate in science degree at ETSC. Tennessee State Board of Education granted authorization to ETSC to implement the program and establish a school of nursing leading to the 4-year baccalaureate degree. In the fall of that year, ETSC's BSN program began under the Department of Health with Hazel Fowler, RN, as director of the program and John Lamb, Jr. as program coordinator. By then, Memorial Hospital had already accepted its last class of diploma nursing students, and along with ETSC, agreed Memorial's diploma nursing program would be phased out over 3 years, 1954 to 1957. Memorial's RN diploma graduates, including graduates from other approved diploma programs, were granted credit by ETSC for previous coursework and the opportunity to complete the BSN degree at ETSC. They entered as RN diploma graduates and took approximately 1 additional year of courses beyond their RN diploma program, graduating with a BSN degree. This was the case of the first graduate from the ETSC BSN program. She earned her diploma from Memorial Hospital in the spring of 1954 and graduated with a BSN in 1955. This transition could be considered a forerunner to the formal RN to BSN program today.
As a senior, we had an aptitude test at ETSU, and I thought, well, I'll take that test, and if I do well, I'll know that the nursing part, then I'll know that that would be my field. And if I don't do well, I will think about doing something else. My mother and daddy did not want me to go into nursing. They said, nurses are loose women.
In 1957, Memorial Hospital School of Nursing graduated its last class of diploma nursing students. The Memorial Nursing program closed and became absorbed by ETSC's BSN program. Memorial Hospital remained open, providing a clinical site for ETSC's nursing program. In 1958, 7 students who entered in 1954 and completed the 4-year program graduated with a BSN degree. When I was in elementary school, my mother tells me I entered a contest for, it must have been done by Curity Band-Aids, because I won a Curity Band-Aid nurse's hat and a Curity nurse doll, which I carried everywhere according to my mother. In 1963, ETSC became East Tennessee State University. The nursing program continued to grow, and in 1967, due to the need to produce technical courses in a shorter period of time, the associate degree in nursing program was established at ETSU, and the first such program in East Tennessee. Eleanor Loury was the first chair of the ADN program. ETSU was one of the first schools to have both a BSN and an ADN program operating at the same time. The program was offered in cooperation with Bristol Memorial Hospital and conducted at their hospital. Eventually, the ADN program moved to the ETSU campus and closed in 1997 following national trends.
Coming to East Tennessee State University was quite an experience. They had a recruitment program for students, and as a graduate of Greenville High School and interested in nursing, I traveled to a Knoxville hospital to one of their career weekends. We would spend the night in the dorm and see the classes, and then I traveled to East Tennessee State University for their career overnighter, and we did stay in MacArthur Hall, actually, which is now on Watauga Avenue, and a mental health facility or branch of that.
When I arrived at John P. Lamb Jr. Hall, there was neither an office for me nor for a secretary, and space in the baccalaureate program was taken to create the School of Nursing space. I was at ETSU as a dean from 1979 to 1985. The National League for Nursing was the only accrediting body of nursing programs at that time. Along with the Board of Nursing Practice, pretty much the curriculum was controlled by those two groups.
Well, my name is Jo Ellen Edwards. I came to ETSU as an associate professor in 1989, and I was dean of the college from 1994 to 2004. One of the things that I wanted to do, and the faculty were very much very positive about the idea of expanding graduate education. The first graduate was in 2004. We had had about 3 graduates who received the DSN and who then TBR approved the transitioning of their degree to the PhD, and we've been a PhD program ever since.
I am presently the coordinator of the interprofessional education program in the undergraduate program here at ETSU. We were very fortunate here at ETSU to have received the Kellogg grant back in the 90s. That was truly the start of interprofessional education and the rural program here at ETSU.
I have been part of the College of Nursing since 1986, so I have a long history with the college. Our goals at that time were to get students in that were at risk into the peer mentoring program, and also to get services of peer tutoring. We also believe that the peer mentor tutor program helped prepare these nurses to be competent and compassionate for their patients currently, and also to be the nurse leaders that are out in our community and in the profession.
My primary goal was to use my vast experience not only in acute care but also in primary care as a family nurse practitioner. I felt I had a lot I could bring to the table as an educator, and to share those not only in advanced practice but also at the undergraduate level. Defining moments during my tenure has been, of course, their building grant, that $6.8 million in building funds for the Johnson City Community Health Center, where it did bring in the, talking about interprofessional, the groups from the clinical and rehabilitative health sciences all under one roof for access to services from our patients.
It's been my privilege to be in this position for the past 5 years, but graduate programming at the college has existed actually since 1992. In 2001, we received approval from the Tennessee Board of Regents to begin a Doctor of Nursing Science program, which was our first doctoral program. We admitted students to that program in 2002, and then in 2007, the degree was redesignated to a Philosophy of Science or PhD doctoral program by the Tennessee Board of Regents. To date, we've had 4 graduates from the MSN to DNP program, and we have had 8 graduates from the BSN to DNP program just this past May, and we're very happy to share that 100% of those nurse practitioner concentration students have passed their certification exam. So with the blended online model, we really feel like we have the best of both worlds.
I have been the dean since 2009. We are now close to 1,200 students across baccalaureate to doctoral level programs. Over the last about 3 years, we have been working on an initiative with all of the graduate programs in the 5 colleges, and our nursing students have participated in that. And we hope, as I said, to see an enlargement of those initiatives. What are some of the defining moments since I've been dean? Well, the growth of the college, the growth of the number of students and faculty, the growth of the number of programs that we have, the growth of the clinics, certainly having faculty and administrators who are forward-thinking and moving us to position ourselves for the future of healthcare and nursing. Those accomplishments that will occur in the next 60 years will be exponential to what they are today.